Hi, my name is Brittany Yerkes. I'm a physician assistant practicing on the Eastern Shore of Maryland for the last 15 years in HIV medicine. I'm here for the CABENUVA Ask Me Anything series. Come on, follow me.
CABENUVA is for virologically suppressed adults and adolescents with HIV-1 who meet certain requirements. See full indication on screen. It is contraindicated in patients with a previous hypersensitivity reaction to cabotegravir or rilpivirine and in patients receiving the medications listed here. Please watch the entire video for additional important safety information. Please click the link to view the prescribing information for CABENUVA.
Thanks for joining me. Let's get started with our first question. How does your team manage a CABENUVA injection day? So as the provider, in my practice, if I'm there on a day when a patient is receiving a CABENUVA injection, usually I will go ahead and walk through the visit with them, assessing how they're doing on their medications, reaching out to the nurse case manager so that she can go get the medication and allow it to sit to come to room temperature, and then proceed with the injections. She's the primary injector for CABENUVA, and she oversees a team of nurses and medical assistants who assist us as needed. And we also have a clinical pharmacist on site who is available for any issues that arise, like access or with medication insurance issues, who is also there for patient support and also for our staff. Our main CABENUVA injection day is on Wednesdays, when we typically see around 5 to 6 patients. On other days, we schedule 1 to 2 CABENUVA patients as needed. Okay, great. Let's move on to another question. What helps make a CABENUVA injection day stay efficient in your practice? So that's a really good question. So in my practice, it really comes down to everyone knowing their roles and really that being well defined before a patient even shows up in the office. So our nurse case manager coordinates our CABENUVA program. She schedules patient visits at least 1 year in advance. Another thing that our clinic has done is that we've coordinated with a local specialty pharmacy so that if there's any issue with access, we can call the pharmacy and directly talk to someone to see when that medication is going to be available. Okay, let's take our final question. How do you counsel and support patients throughout their CABENUVA injection experience? In my practice, it really starts with when the conversation about CABENUVA is initiated. I try to have a talk about what treatment options are available with patients at least annually. If it's a patient who's appropriate for CABENUVA, and if it's someone who says, oh, no, I haven't heard of that, or that's something I might be interested in, then we talk about what to expect. So when the authorization process starts, patients are responsible for talking to specialty pharmacies to give verbal consent that the medication can be sent to the office. So I always try to inform them, hey, I know you're going to have maybe some phone numbers calling you that you aren't used to, but know that this may be about this medication. I talk to them about what to expect on an injection day, how to prepare for it, and also what to expect after a CABENUVA injection day. On injection day, I reinforce the importance of adherence to the every 2-month dosing schedule and make sure that patients know when their next appointment is. Many patients of mine are so appreciative to have a different option. So having the opportunity to be on CABENUVA is just such a different conversation than we've been able to have for many years. Thank you so much for tuning in to Ask Me Anything about CABENUVA. I hope that you have the opportunity to watch other videos in the series.
Warnings and precautions. Hypersensitivity reactions. Serious or severe hypersensitivity reactions, including Stevens-Johnson syndrome, toxic epidermal necrolysis, and drug reaction with eosinophilia and systemic symptoms, or DRESS, have been reported with CABENUVA or its components. Some skin reactions were accompanied by symptoms such as fever. Other skin reactions were associated with organ dysfunctions. Oral lead-in may be administered prior to administration of CABENUVA to help identify patients who may be at risk for a hypersensitivity reaction. If a hypersensitivity reaction is suspected, CABENUVA should be discontinued immediately and the patient should be monitored. Post-injection reactions. In clinical trials, serious post-injection reactions, such as those shown here, were reported in less than 1% of subjects within minutes after the injection of rilpivirine. These events may have been a result of accidental IV administration and began to resolve within a few minutes after the injection. It is important to carefully follow the instructions for use and observe patients for approximately 10 minutes after the injection. If a post-injection reaction occurs, monitor and treat as clinically indicated. Hepatotoxicity. Hepatic adverse events have been reported in patients receiving cabotegravir or rilpivirine with or without pre-existing hepatic disease or identifiable risk factors. Patients with underlying liver disease prior to treatment may be at increased risk with CABENUVA. Hepatic monitoring is recommended and discontinue if hepatotoxicity is suspected. Depressive disorders. Depressive disorders have been reported with CABENUVA or the individual components. Promptly evaluate patients with depressive symptoms. Risk of adverse reactions or loss of virologic response due to drug interactions. Adverse reactions or loss of virologic response due to drug interactions with concomitant use of CABENUVA may occur. Use with caution in combination with drugs with a known risk of torsade de pointes. Long-acting properties and potential associated risks with CABENUVA. Residual cabotegravir and rilpivirine concentrations may remain in the systemic circulation for up to 12 months or longer. Non-adherence to injections could lead to loss of virologic response and development of resistance. It is important to initiate a fully suppressive regimen no later than 1 month after the final injection doses of CABENUVA when dosed once monthly, and no later than 2 months after the final injections of CABENUVA when dosed every 2 months. If virologic failure is suspected, switch the patient to an alternative regimen as soon as possible. Adverse reactions. The most common adverse drug reactions were injection site reactions, pyrexia, fatigue, headache, and those listed here. Drug interactions. For important drug interaction information, refer to the full prescribing information for CABENUVA, Vocabria for oral cabotegravir, and Adurant for oral rilpivirine. It is not recommended to co-administer CABENUVA with other antiretrovirals. Drugs that are strong inducers of UGT1A1 or UGT1A9 are expected to decrease the plasma concentrations of cabotegravir. Drugs that induce or inhibit CYP3A may affect the plasma concentrations of rilpivirine. Use in specific populations. Assess the potential risks of using CABENUVA during conception, pregnancy, and while breastfeeding. Please click the link to view the full prescribing information for CABENUVA.